How are you? Good. So thank you for coming in. I have on my notes that you are experiencing anxiety. Okay. Do you want to tell me a little bit about what that feels like? Okay. Okay. So in a moment I am going to go through some questions with you just to find out a little bit more about the anxiety. Okay. Before that, what I'm going to do is I'd just like to have a listen to your heart, okay, and then take your blood pressure. I just would like to rule out that it's anything else. It's very unlikely to be anything else, but I'd just like to make sure that it is anxiety you're experiencing, as some of the symptoms do overlap with a lot of health concerns. Okay, nothing to worry about, it's just something that we do as a measure here anyway. Okay, so what I'm going to do first is just going to have a listen to your heart. So if you could just lift your top up for me. That's great, thank you. Okay, so just a bit cold, and just keep lovely and still for me. Okay. Okay. If you could just keep your breathing just as you would normally, okay? I'm just going to move it slightly. Okay, I'm just moving it slightly. Okay, that's great. Everything's normal, okay? I am just going to check your blood pressure now, if that's okay. Great. Okay. And if you could just lift your arm up and push your sleeve back. So we do use quite an old-fashioned tool for this, but we feel it gives the best results. Most accurate. Okay. Okay. Okay, so if it's alright with you, I'm going to run through some questions. Okay, some of them might ask you something that kind of makes you feel quite emotional. or you might feel like you're not ready to share something with me, and that's absolutely fine, okay? I just need it to kind of get a better idea of how you're feeling, so whatever you feel you can share, that would be great. Alright. Okay, so let's do today's date. Right. So what's your full name? Date of birth? Okay. And do we have an emergency contact for you? We do, okay. And are you currently working with a key worker? Okay, or a social worker? Okay. Great. Okay, so I'd just like to find out a little bit about where you're at right now. So, how are you feeling? You could talk about your mood, any kind of changes in thoughts or feelings. Right, okay. So you're feeling anxious, right? Energy levels? Okay. Okay, right. So, kind of feeling like things can go up and down quite quickly. Okay. And how long would you say you've been feeling this? Okay. And do you feel like things have got worse? Stayed the same? Okay, so mostly the same, but starting to worry things are getting worse. Okay. And in terms of physical symptoms, what are you feeling? So is it the tight chest or what? Okay. Okay, so sometimes a tight chest, yeah. Kind of feeling like your heart's pounding, okay. Yeah, so obviously I've had a listen to your heart and I've taken your blood pressure. They're both normal, okay. So I would probably suggest that this is anxiety related. So, you know, as you've just said, you know, describing the heart pounding and the tight chest, I would kind of directly link that to anxiety. Do you have asthma? Okay. And so you've talked about having a tight chest. Any kind of other physical symptoms? Okay. Some sleep paralysis. Interesting. Okay. Sleep paralysis is normal. Okay. It's something I experience. I would say that it's sometimes worse with stress and anxiety, as are nightmares. Yeah, it's really important if you do experience sleep paralysis that you make sure that you go to bed and wake up at the same time. Okay, I know that mine is worse if I try to go back to sleep. Yeah, mine's been quite bad recently, but I think that's just more work stress. Yep. There's no evidence to suggest that it's dangerous. Okay, it is obviously quite a frightening experience. Yeah, but I would say, you know, let's put it down to one of the anxiety symptoms, and you may find that with your anxiety improving, the sleep paralysis may also improve. Okay. In terms of eating, loss of appetite, or... Okay. Oh, everyone's different in that aspect. I know that when I am anxious, I tend to not eat, whereas some people feel the opposite. They feel like food is a comfort to them. Yeah, okay. And are you feeling kind of quite depressed at the moment, or... Okay. And in terms of your general mood, any depression? Okay, so I just want to ask a few questions about your lifestyle. Do you have friends, family, colleagues around you? Okay. And how often do you get to see them? Okay. Do you feel like they support you? You feel like you can talk to them? Okay. That you are experiencing panic attacks? Okay. So, what I would say is all of our therapies here, okay, are designed to help your anxiety, and that includes the kind of brain side of things, so thoughts and feelings, yeah. And in hand, they will help the physical symptoms as well, yeah. Yeah, anxiety is such a broad condition and it affects people in lots of ways, yeah. But we do find that our therapies here can be very helpful. So we do Cbt therapy, and that looks at actively changing thought behaviour and patterns. And we do something called ACT therapy as well, and that's more about working on the here and now. You can join one of our group therapy classes as well. Yep, they're sometimes really helpful for people. It really depends, if you feel like you're ready to kind of share things with other people. What I can also do is give you some activities to take away, okay? So whatever therapy that we want to give you, we will make sure that you have enough stuff to take home and kind of work on it in your own time. Yeah, absolutely. We do prescribe, but we do prefer to stay away from medication. They can, in some people, just mask the problem. In some people with more severe conditions, it is necessary to use medication. But in your case, and in the case of millions of people, we do feel that more of a holistic approach and talking therapies make the biggest difference. Okay. So, I'm just going to have a look through some of my notes, and I'm going to suggest the therapist for you and the right therapy. Okay. Okay, I think I've found a therapy that would work quite well for you. Okay, you've talked about wanting to focus more on the now, here and now, and kind of working to feel less anxious and relieve some of those physical symptoms. Okay, so I think I have a type of therapy that would work really well for you. Okay, so I will talk you through that, and I'm going to do an activity with you before you go. Okay. Before I do that though, I am just going to have a physical exam. Okay, it's nothing intrusive. Okay, you might find it quite relaxing. It's something that I like to do with my patients. Okay, and it can be relaxing. What I'm going to do is I'm just going to have a feel around your body for some of the stress areas. Okay, so that's around the temples, around the neck and the shoulders, and in the hands. Okay, I'm going to focus on those areas, and once I've done that, we'll go into the therapy a little bit more. Okay. Okay, so if you could just sit nice and comfortably for me. Great. So I'm just going to have just a feel on your temples, okay? Painful at all? Okay. And just on your jaw, okay? Because teeth clenching can cause swelling and pain. Okay. So just feeling. Okay. How does that feel? Okay. And now just your neck. Okay. So some swelling. Okay. Especially just, is that painful? Okay. Okay, just feeling down your arms. And now looking at your hands. Okay. Okay, hands are not too bad. Okay. Okay. Okay, so you've got some of the kind of typical slightly swollen jaw, okay? Some slight pain in the temples, okay? And they're all symptoms, I would say, of stress and anxiety, okay? And I might suggest you get a massage when you can, okay? Alright, so I'm just going to tell you a little bit about the therapy that I thought would work quite well for you. Okay. So the therapy that I think would work quite well for you is called ACT, okay? ACT therapy. And ACT therapy has 6 core processes, okay? So the first one is about contacting the present, okay? So that is about feeling in the moment, okay? Being conscious of what's around you, taking notice of what's around you, yep, and slightly stepping out of what's going on in your head. So the next element is called diffusion. Okay, so diffusion is about separating yourself from your thoughts. Okay, so it sounds a little bit complicated, but it's really quite easy. Okay, it's all about acknowledging your thoughts. That's it. Acknowledging your thoughts and seeing them as something that's separate to you. Okay. The next kind of element is called acceptance. Okay, and acceptance is just accepting what you're worrying about. So it's thinking and feeling okay with the fact that you're worrying. Okay, it's not about resolving it. Okay, it's not about judging yourself. It's just about acknowledging and accepting. Okay. So the next element is about observing the self. Okay, so people don't realise it, but there are two kind of ways at looking at the mind. Okay, there is the observing self and there is the thinking self. Okay, so day to day we tend to live our lives in the thinking self, and that means that we are sometimes unaware of what we're doing, unaware of what we're feeling. Okay, and we are just kind of taken away with our thoughts. Okay, the next element is about values. So values are really centre to ACT therapy. Okay, it's about what are your values, what is important to you. Okay, sometimes it can take a little bit of thinking on what those values are, and we can do some work around that if you'd like. Yeah, but for now it's kind of just being aware of what some of those might be. Okay, so the final part of ACT therapy is about committed action. Okay, so it's using your values and making decisions and acting on them. Okay, so if you have a value, something that means quite a lot to you, or somewhere that you know you want to go to, it's about acting on that and not just waiting for something to happen. It's about you getting yourself to that place. Okay, so I'm just going to make some notes from the physical exam. Okay, and then we did the jaw, some slight swelling. Okay, tense shoulders. And hands were okay. Right. So I'm going to do one activity with you, and this is about letting those thoughts go. Okay, and I want to do this with you now because I know that you could go away and take this away with you. Okay, I find that it's a really nice way to help me get to sleep. Yeah. Okay. So it's nice and relaxed. Okay, so initially we're just going to sort out our breathing. Okay, so nice deep breath in. Okay, not too fast, just nice and slow. Okay, so okay, keep that up for me. And now I'd like you to just close your eyes. That's it. Close your eyes. Okay. I'd like you to visualize yourself lying on a bank of grass. The grass is nice and green. It's a lovely sunny day. It's not too hot, but the sun is just gently warming your body. Okay. And if you're wiggling your hands, you can feel the grass between your fingers. Okay. And you can hear a sound of water. And what you have next to you on the bank is a stream. Okay, so you can hear the water hitting against the rocks. It's making a relaxing, trickling sound. And next to you as well is a tree. And on the tree are large red leaves. And if you lift your arm up slightly, you can just pick one of those leaves. And it's bright red, really big. And what I'd like you to do is I'd like you to take one of those thoughts, one of those negative thoughts that's been causing you pain and suffering. And I want you to take your thought out of your head, place it on the leaf, and put the leaf on the stream. And then I'd like you to watch it move down the stream with the water. Okay. And then I'd like you to keep breathing while the leaf is moving down the stream. Okay. Nice deep breaths. Okay. And then you pick another leaf and you take another thought and you place it on the leaf. And I'd like you to watch this thought flowing down the stream. Okay. This is not about pretending those thoughts don't exist or waving goodbye to them. It's about acknowledging and watching it go past. Okay? Nice deep breaths. And every time you feel like you're becoming distracted or your mind takes you elsewhere, just remember the grass between your fingers and take that thought, place it on a leaf and watch it go down the stream. Let the stream run at its own pace. Okay, it's not gushing away, it's gently moving down the stream. Okay, and these can be positive thoughts, negative thoughts, neutral thoughts. Anytime a thought comes into your mind, just take it, place it on a leaf, and let the leaf move downstream. You may find that some of those leaves come past again, the same thought. You let it sit on that leaf and watch it go past again. Okay? And now you may want to take 20 seconds or so just looking at the sky and breathing. But as soon as you feel another thought, just take it out, place it on a leaf, and let the leaf flow downstream.